One magic vitamin heals your kidneys quickly. Today, we will dive into the fascinating world of kidney health. Did you know that our kidneys play a crucial role not only in filtering waste, but also in regulating blood pressure, balancing electrolytes, and producing essential hormones? But what happens when they fail? And how can we detect warning signs before it's too late? Have you heard about proteinuria, this silent indicator that can signal serious kidney issues? And what if I told you there is a special vitamin that can be an unexpected hero in the fight against kidney damage, especially in cases of proteinuria? Stay with us until the end to discover how a holistic approach, which integrates balanced nutrition, stress management, and emotional support, can be the secret to preserving kidney health and promoting overall well-being. Don't miss the valuable tips we have for you, as they could be the difference between life and death. Let's get started. Importance of kidney health. Kidney health is fundamental to the balance and proper functioning of the human body. The kidneys are vital organs responsible for filtering waste and excess from the blood, maintaining fluid homeostasis, balancing electrolytes, regulating blood pressure, and producing essential hormones for the production of red blood cells and the maintenance of bone structure. When the kidneys fail, toxic substances and waste accumulate in the body, leading to a series of serious complications, including hypertension, anemia, weakening of the bones, damaged nerves, and poor nutrition. Furthermore, chronic kidney disease, CKD, can increase the risk of cardiovascular diseases, which are the leading causes of death in people with kidney failure. The progression of kidney disease often is silent and slow, meaning many people do not realize they have kidney problems until the condition is at an advanced stage. This underlines the importance of regular health exams that include kidney function tests, especially for individuals at risk, such as those with a history of diabetes, high blood pressure, or heart disease. Early detection can allow interventions that slow the progression of the disease, preserving kidney function and improving quality of life. Proteinuria. Proteinuria, characterized by the excessive presence of protein in the urine, is an indicator of kidney damage. Normally, the kidneys filter waste from the blood while retaining essential proteins in the body. The presence of proteins in the urine suggests a failure in this filtration mechanism, which can be an early sign of kidney disease. The condition can range from transient, common after intense physical exercise or infections, to persistent, which usually indicates more serious kidney problems. Several factors can contribute to the development of proteinuria, including diabetes, high blood pressure, autoimmune diseases, kidney infections, and exposure to toxic substances. Diabetes and high blood pressure are the most common causes, as they damage the blood vessels in the kidneys, compromising their filtering capacity. Without treatment, proteinuria can lead to a decline in kidney function, resulting in chronic kidney disease or kidney failure. Early diagnosis through urine tests can allow interventions that minimize kidney damage and improve health outcomes. Treatment of proteinuria involves controlling the underlying conditions, such as rigorous management of blood sugar and blood pressure, and, in some cases, the use of medications that help reduce the amount of protein in the urine. Vitamin D and kidney health. Vitamin D plays a crucial role in kidney health, especially in the context of proteinuria. Recent studies have revealed that this vitamin can help prevent and treat proteinuria, as well as repair existing kidney damage. Vitamin D acts by modulating the renin-angiotensin-aldosterone system, RAS, a key regulator of blood pressure and fluid volume, thus reducing blood pressure and stress on the kidneys. Additionally, it has anti-inflammatory and anti-fibrotic properties, which help protect the kidneys from further damage caused by chronic diseases. Vitamin D deficiency is common in patients with chronic kidney disease, and supplementation can offer significant benefits in reducing proteinuria and improving kidney function. Vitamin D can be obtained through exposure to sunlight, which stimulates the skin to produce it, and through the consumption of foods rich in vitamin D, such as fatty fish, fish liver oil, egg yolks, and fortified foods. Vitamin D supplementation should be considered especially for those at risk of deficiency, including individuals with limited sun exposure, dark skin, obesity, or those following restrictive diets. However, it is essential to consult a healthcare professional before starting supplementation to determine the appropriate dosage and avoid toxicity, since vitamin D is fat-soluble and can accumulate in the body if consumed in excess. Incorporating vitamin D into the management of kidney health highlights the importance of a multifaceted approach in the treatment of proteinuria and in the prevention of kidney diseases. In addition to the direct benefits for the kidneys, vitamin D also supports bone health, immune function, and mood regulation, offering a wide range of advantages for overall health. Including natural sources of vitamin D in the diet, ensuring adequate sun exposure, and, when necessary, resorting to supplementation can be an effective strategy to protect kidney health and promote overall well-being. Sources of vitamin D. Vitamin D is essential for various aspects of health, including bone health, immunity, muscle function, and kidney health. There are two main forms of vitamin D, D2, ergocalciferol, from plant sources and supplements, and D3, cholecalciferol, which comes from animal sources and is produced in the skin under the influence of sunlight. Vitamin D3 is generally considered more effective in raising and maintaining vitamin D levels in the blood. Sun exposure is a significant way to obtain vitamin D, as the skin synthesizes vitamin D3 when exposed to UVB sunlight. However, the amount of vitamin D produced can be affected by various factors, including latitude, season, time of day, skin pigmentation, and the use of sunscreen. For many people, especially those in less sunny climates or with a predominantly indoor lifestyle, sun exposure may not be sufficient to meet vitamin D needs. Foods rich in vitamin D include fatty fish like salmon, mackerel, and sardines, which are some of the best natural sources. Fish liver oil, like cod liver oil, is another potent source. Egg yolks, liver, and certain types of mushrooms exposed to ultraviolet light also provide smaller amounts of vitamin D. Many countries fortify staple foods with vitamin D to help prevent deficiency. Examples include milk, fruit juices, breakfast cereals, and some plant-based milk alternatives. Fortification has been an effective strategy for improving vitamin D status in the general population. For individuals who cannot obtain enough vitamin D through sun exposure and diet, supplementation can be an effective option. Supplementation offers a controlled way to ensure adequate intake of vitamin D, especially for those at risk of deficiency, such as the elderly, people with dark skin, those with little sun exposure, or with conditions that limit fat absorption. When considering vitamin D supplementation, it is crucial to consult a healthcare professional to determine the correct dosage and avoid the risk of toxicity, since vitamin D is fat-soluble and can accumulate in the body if taken in excess. The recommended dietary intake varies depending on age, sex, health conditions, and levels of sun exposure, emphasizing the importance of personalized advice. Incorporating a variety of vitamin D sources into the diet, along with sensible sun exposure, and if necessary, supplementation, can help maintain adequate levels of this essential vitamin, supporting kidney health and promoting overall well-being. Management of kidney health. Managing kidney health involves a combination of healthy lifestyle practices, adequate diet, and regular medical monitoring, especially for individuals with risk factors for kidney diseases, such as diabetes and hypertension. Prevention and early treatment of conditions that can damage the kidneys are essential for maintaining kidney function and preventing chronic kidney diseases. Diet and nutrition. A healthy kidney diet should limit sodium intake to control blood pressure and reduce the risk of kidney disease. Processed and cured foods, high in sodium, should be avoided. Protein should be consumed in moderation, as excessive intake can increase the burden on the kidneys. Sources of high-quality protein include lean meats, fish, beans, and legumes. Additionally, it's important to limit foods high in potassium and phosphorus if kidney damage already exists, as damaged kidneys may have difficulty filtering these minerals from the blood. Hydration. Staying adequately hydrated helps the kidneys to function efficiently and to remove waste from the body. The optimal amount of water needed can vary based on climate, physical activity, and existing health conditions. It's important to balance fluid intake, especially in cases of certain kidney conditions where fluid management is crucial. Physical exercise. Regular physical activity helps to control blood pressure, reduce the risk of chronic kidney disease, and maintain a healthy weight. At least 150 minutes of moderate exercise per week is recommended, such as brisk walking, swimming, or cycling. Control of harmful substances. Avoiding smoking and excessive alcohol consumption is vital, as both can increase blood pressure and consequently harm the kidneys. Medications that can damage the kidneys, such as non-steroidal anti-inflammatory drugs, NSAIDs, should be used with caution and under medical guidance. Medical monitoring. Regular checkups are important for early detection of kidney problems, especially for individuals at risk. Kidney function tests, such as measuring the glomerular filtration rate, GFR, and urine tests for proteinuria, are key diagnostic tools. Adopting these strategies can help preserve kidney health and reduce the risk of chronic kidney disease, improving quality of life and overall well-being. Holistic approach to kidney health. A holistic approach to kidney health recognizes that maintaining optimal kidney function is interconnected with the overall well-being of the body and mind. This approach involves not only managing risk factors and specific medical conditions, but also promoting a healthy lifestyle that supports kidney and overall health. Balanced nutrition. A balanced diet rich in fruits, vegetables, whole grains, and sources of lean proteins, along with limiting added sugars, saturated fats, and salt, can help maintain blood pressure and blood sugar levels within healthy limits, reducing the burden on the kidneys. Stress management. Chronic stress can increase blood pressure and negatively affect kidney health. Stress reduction practices, such as meditation, yoga, deep breathing exercises, and relaxing hobbies, can help manage stress and promote relaxation. Adequate sleep. The quality and quantity of sleep have a significant impact on overall health and can affect kidney health. Establishing a regular sleep routine, creating a conducive sleeping environment, and limiting exposure to blue light from electronic devices before bedtime can improve sleep quality. Social relationships and emotional support. Maintaining positive social relationships and seeking emotional support when necessary can contribute to mental and physical well-being. Social support can offer emotional and practical resources for dealing with health conditions and promoting healthy behaviors. Education and awareness. Informing oneself about kidney health and best practices for maintaining kidney function can empower individuals to make informed decisions about their health. Participating in patient education programs, consulting healthcare professionals for personalized guidance, and accessing reliable resources are important steps in this direction. Adopting a holistic approach to kidney health involves caring for the body, mind, and spirit. Integrating healthy practices across all aspects of life can optimize kidney function, prevent diseases, and improve overall well-being. If you or someone you know is experiencing kidney problems and is considering using vitamin D or any other intervention, it is crucial to consult a healthcare professional for proper and personalized guidance. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video.